Most employer mental health programs focus less on helping employees maintain good mental health and more on treating mental illness. Even then, employees often are afraid to seek help at work due to fear of being stigmatized or because they can't afford access to mental health services.
Our guest today is Dr. Nick Taylor, CEO and co-founder of Unmind. Unmind is a digital mental health platform. Prior to joining Unmind in 2016, Nick was lead clinical psychologist in Britain's National Health Service. Today, he'll discuss how employers can help prevent employee mental health challenges before they arise and how to ensure that employees receive early treatment. Nick, it's a pleasure to have you on our show.
Thank you so much for inviting me on.
What's your definition of mental well-being and how it connects to other aspects of our lives?
Well, I think probably the definition by default connects to other aspects of our lives. I think when we think about mental health, it's important to take a whole person approach to understanding it. It's made up of psychological factors such as our personality, the core beliefs that we have about the world around us, how psychologically safe we feel, etc. But it's also made up of social factors such as our home environment, our work environment, our family network, our friendship network, how we relate with other people, our financial health, and then finally physical health as well. So our age, our gender, our disease stages, our nutrition, how well we're sleeping, and all of these things together combine really to uniquely position you on the spectrum of mental health, which we will inevitably move up and down throughout our life.
Right. There's a strong relationship between physical health and mental health. I realize you understand that, and many people do, but I think it's lost on a number of people.
I think that's right, and I think that's why we can get a lot of value out of looking out for it. For examples where mental and physical health are really strongly linked. But in our personal lives, we can just observe what it feels like to have slept well, or to,
Right.
I always think there's the relationship between eating a chocolate bar and going for a run is kind of inverted. So I always feel really excited before the chocolate bar, love eating it, and feel dreadful afterwards. But if you go for a run, you feel, well, I feel kind of dread it before it, just about get through it, but feel great afterwards. We can see it in our own life, the relationship between physical and mental, but you can also see it in professional athletes who really, it's not just about how strong their body is, it's about their mindset and the mental game that they're playing as well. So it's really important to look out for ways in which the two are linked.
Is it fair to say that mental well-being, our conscious experience of life, actually precedes the ability to achieve physical well-being? How we're feeling about ourselves, how we're feeling about our future, the amount of stress we're under. I mean, that can really impact how well people are able to take care of themselves physically. And I'm sure, as you're aware, the paradigm we've lived through for many years is that physical is overarchingly more important than everything else. Mental health has been sort of an afterthought.
Mental health has been the kind of poor cousin for years. It's been the one that's been kind of buried under the hatchet, slightly hidden away because of the stigma surrounding it. But actually, it's the one that we should primarily focus on, because, like you say, if we have good mental health, it actually makes it easier to achieve other areas of our life, be that good physical health, good relationships. I think intuitively we all get that if we're well and we're optimized, then we have the best opportunity to provide our optimum contribution. However, it is also possible to have poor mental health and still contribute. So it's important that we don't accidentally create a secondary stigma, which is like, well, if you've got a mental health problem, then you're not going to be able to add value. It's not true. You can also add value. But I think we all intuitively get that to get the best performance, you want people to have the best opportunity to be their best selves.
Yeah, mental health issues were rising rather dramatically even before the pandemic. And you've said that lockdowns have increased the prevalence of mental health issues. Going forward, what's changed? How should employers see their role now as we hopefully pivot out of the pandemic? How should they see their role with regard to mental health?
The trend towards employers taking a more active role in the well-being of their employees was here before. I think what the pandemic has done is create two macro trends. The first is that, going back to that idea that our mental health is made up of psychological, social, and physical components, all of those areas of our lives have been negatively impacted one way or another as a result of COVID. The pressure has been significant. And what that's done is put an increased pressure on our mental health. And therefore, it's little surprise that we have seen an increased prevalence of burnout, of mental illnesses, and they're reported across many studies that have been conducted around the world. As a result of the spotlight being shined on mental health, and because we're conscious of the risks, we have allowed the conversation to become more normalized, and therefore the subject has become more easy to speak about, and that's actually unshackled the topic from some of the stigma that's held it back. So there is a positive macro trend as well, and I think what that's led to is that initial trend I was talking about being accelerated, and organizations are now caring for their people more than they might otherwise have been at this point in time had there not been a health pandemic.
As we pivot out of the pandemic, a lot of these negative mental health conditions that have arisen because of the pandemic, they're not just going to go away like the flu, do they?
I mean, that's the thing about mental health is rarely, if ever, do you go to bed on Monday night with no symptoms of depression and wake up on Tuesday morning with clinical depression. You know, it doesn't do that. What we have here is the world's population has been through a tough period. We are heightened stress, heightened pressure, increased prevalence of mental illness. Like you say, it's not going to go away. And that's why we need now to support more than ever employee mental health in this next few years and beyond.
Prevention obviously reduces the potential human cost of mental health disorders, whatever their degree of seriousness, and it's practically a lot less expensive to focus on prevention. But talk about what you mean by prevention and what types of mental health conditions are preventable.
Prevention's better than cure. Everyone gets that intuitively. I've never met anyone I've said that to who says, well, I'm sorry, I don't agree. When it comes to understanding the root cause of mental illnesses and also the paradigm of mental ill health, it's important to recognize it's complex, and different types of disorder have different root causes and different levels of genetic contribution, different levels of social contribution, different levels of psychological contribution, etc. But what we can all be doing is continuously working on our mental health, understanding how we operate psychologically, understanding topics such as the importance of sleep or how to listen well or how to communicate. And irrespective of your circumstance, that learning, that information, that understanding is going to benefit you to proactively manage and nurture your mental health.
Why do people delay getting mental health treatment, and what can employers or any of us do to help that?
It's actually a systemic issue, and every part of the world is going to have a different relationship that individuals have with accessing care. But it's actually not very easy to access care, generally speaking, because either there's long waiting lists, or people can't afford it, or people don't know where to turn, or even people don't recognize in themselves that they've got to the point where professional help might be really valuable to them. And also, this is a topic that in many places around the world is immensely difficult to discuss. So there's a huge stigma barrier that makes it harder to access care.
There was a November 2019 study by Mindshare that found that younger employees suffered disproportionately from long-term mental health episodes. But even so, these younger workers, millennials and Gen Zers, they seem to be more open to diagnosis and treatment. So what can employers do to take advantage of this?
I think that we've seen such a tremendous amount of progress in normalizing mental illness in the workplace. There have been some very courageous leaders that have publicly spoken about their own lived experience of mental illness, and that's helped to normalize the topic. But I really think the next step here is that we need to normalize mental health as a subject per se, not just normalize mental ill health. Because we all have mental health all of the time, and we can actually speak about it on a daily basis, and that helps us practice. You know, there's a danger that in just training people to know how to have difficult conversations if someone comes to them saying they've got a problem, in just normalizing the topic of illness, what we're really doing is just normalizing the topic around the 1 in 5. That means that people will wait and wait and wait before they start talking. We need to normalize mental health as something we all have all of the time. We need to get people to be checking in on a daily basis as a manager saying, well, I'm a bit tired today, or I'm feeling quite pressured or stressed because of X, Y, Z, or my mood is low. These are not clinical problems. You're just reflecting on how you're feeling. We all feel these things, and that helps to get people practicing their mental health, practicing thinking and checking in and understanding their mental health. And that's so valuable to then ensuring that when things get more difficult, they are feeling comfortable with discussing the topic.
Any advice to employers of how they should be looking at their EAPs with regard to mental health?
What I would encourage is know your organization, understand what your goals are, build a strategy that you're committing to in long term, and ensure that prevention sits at the heart of what you're doing, because prevention is better than cure. You have an option with mental health. You can focus on 1 in 5, depending on where you are in the world, or the 1 in 6 people with problems, or you can focus on the 5 in 5 or the 6 in 6. And actually, that intuitively to all of us makes more sense, because then you can facilitate people to stay well, rather than just always waiting, which is what's happened historically, for people to get unwell before you then help them get back to well-being.
In the United States especially, it's a topic that doesn't get as much attention as it should, and that is that lower paid employees, which constitutes at least 50% of the workforce, those people living paycheck to paycheck, simply cannot afford to get mental health services when they need them. It's a reality, it's well talked about, and hopefully there'll be some changes, but in the meantime, we still have a lot of people experiencing problems. Lower paid workers have poor work-life balance, the financial stress, of course, which leads to other long-term stressors. What do you think employers need to be thinking about in terms of ensuring all of their workers, not just the highly paid workers, have access to mental health care prevention and other services as needed?
I think that's such a great point. And I think this is why organizations have such an exciting opportunity to make a profound difference to parity in access to healthcare. They have an opportunity to ensure that their employees, no matter what their socioeconomic position, are able to access timely mental health care, meaning they get the right care at the right time, resulting in the right health outcome. The beauty of prevention in mental health is that it can leverage digital very effectively. And digital is eminently scalable and affordable. And I think it's really important to take hold of that opportunity and recognize that the cost is actually incredibly good value in comparison to many other things that we just see as standard now in the workplace. There's been such a global focus on health and safety, but safety's owned so much of that budget for a long time now. Make sure that you're allocating enough towards health.
What are your thoughts about what you're seeing about the sorts of companies, or maybe the mindset of companies that are taking these steps early on in prevention, using the digital tools, and for those that may be hesitating or see challenges, what's the way forward there?
I think it's really important to recognize that every organization has a slightly different workforce, and therefore what will work for one might not necessarily work for another. I do believe that in this space that there's a really brilliant and vibrant community of health, HR and people leaders that collaborate together to share best practice, and enormous amounts can be taken from peer learning. I think it's really important to remember that Rome wasn't built in a day. The rolling out new initiatives and programs take time to embed, and it takes time to get buy-in with them. And also sometimes it takes time to get the trust of the employees to get used to this new idea that actually work is providing me with this. Historically, work wouldn't provide me with that. It takes time to build that trust. And I think the communication campaigns that go alongside the rollout of any program within the workplace need to be very carefully considered and specifically designed to resonate within that group of people.
In your experience, talk a little bit about workplace culture and environment and the importance, because I imagine even a program as good as your Unmind, if you put it in a toxic culture, it's probably not going to work very well.
I totally believe in the importance of culture in facilitating well-being for individuals. It comes down really to psychological safety. If people feel psychologically safe, they will engage, they will share, they will be able to demonstrate vulnerability, they will be able to ask for help. This is not a short-termism topic. This is a long-termism topic. Right. You embed this with a commitment to long-term change.
Okay.
It will not happen overnight.
What would you say about the importance of managers and what employers should think about getting them and coworkers involved in each other's mental health?
It is important not to put too much pressure on managers. I hear a lot of people talking about, well, we're training our managers to spot the signs and symptoms. As a qualified clinical psychologist, I still can't just spot the signs and symptoms that easily always. And if somebody comes to me and asks for help, my heart does slightly miss a beat, or I do feel anxious on occasion when people ask me about particular topics, despite having all of the years of clinical qualification experience that I have. So it's important to help to not put too much pressure on managers here. You're not going to become a clinician overnight. You're not expected to know the answers. You're not expected to remember always how to respond. So I think that's the first thing. That said, I think there is enormous value in helping to educate managers about the topic of mental health. But it's really important here, not just the topic of mental ill health. Let's educate managers about the topic of mental health, i.e., we all have it all the time. Let's make sure that we educate managers on how to listen. It's remarkably straightforward to listen well and so commonly misunderstood. So let's really help people learn how to have a good conversation, how to listen, because that will help in enabling people to share how they're feeling.
Talk to us about the benefits or returns for employers that take steps that can improve the mental well-being of their employees.
I think it's really valuable, though, to leverage data and to start looking at trends. By investing in mental health, you would hope in the long term to see a reduction in absenteeism, in a retention of staff, in basically an improved culture, improved performance, these type of topics. But actually interpret the data with care, because you might also find that by educating your workforce around the topic of mental health really well, you see an increased prevalence of absenteeism because people are acknowledging and recognizing in themselves what they've been feeling, and they acknowledge and recognize and feel safe enough in their environment to take some time off to get better. So just be data driven. You will see the positive trends, but interpret that data with a critical and considered eye.
You advocate for how employees should be encouraged and given the tools to take stock of their mental health every day. We talked about that a minute ago. So tell us what Unmind does as a company to facilitate that. How does that work?
So Unmind is a workplace mental health platform. So from day one, everything we've done and everything we're about is focused on organizations and their employees. And we bring value in two ways. The first value is to the employee. What an employee experience on the platform is, they download Unmind onto their phone or access it via a computer, create an account, and the first thing they'll be invited to do is to complete the Unmind Index, which is a tool that we've developed in-house in collaboration with experts at the University of Cambridge and University College London. It's a series of questions, and based on your scores, you'll be given an overview of how you're doing in your mental health. And we don't give you a score in depression, anxiety, and stress. It's positively skewed questions, and you'll get scores in positively skewed kind of sections. So, for example, coping, calmness, and happiness, sleep, fulfillment. Based on your unique scores, you're then signposted to content on the platform, which we've developed with world-leading authors, academics, and clinicians that's really high quality, based on very solid science, and delivered in bite-sized chunks so that you can fit it around a busy diary. The platform has a lot of functionality on it. So there's a daily mood checker that you can use to track your ongoing mood, that you can send praise to colleagues and loved ones for behaviors that are known to be positive for mental health. We signposted all of the services that you have in your organization, again, helping you get the right care at the right time. And then also we offer a +1 feature that you can gift a version of the platform to any loved one as well, so they can work with their mental health. And the content on the platform is very varied, from understanding menopause to understanding how to listen better, to listening to the captain of the New Zealand rugby team speak about how he overcame breaking his neck to captain the most successful sports team of all time. So it's incredibly varied. Then from an employer perspective, the value that they get is they get aggregated and anonymized, and the anonymity is key, data that allows them to understand how their people are on a macro basis so that they can then design well-being strategies for their people.
You recently opened an office in the United States. What are your hopes going forward? What are your plans?
Our headquarters is in London, but we opened an office in Sydney, Australia, but also in New York as well. And we're incredibly excited about the global trend that we see really moving from that reactive mental health workplace to a proactive mental health workplace. And we see that trend globally. And I think the United States is really doing a phenomenal job in moving towards a more proactive and preventative approach. And we work with some incredible companies in the US, and we're really proud to partner with them, the likes of Uber, for example, in supporting the workforce. And so we really see over the past 5 years, we've seen a massive shift in the US away from a very focused reactive model to a much more proactive model. And we're excited to bring our approach of really leading the charge in proactive mental health into the US.
In the US, we have health insurance. In UK, you have the National Health Service. One would say, from at least my observational experience, is that access in the UK is quite a bit better than it is in the US. So I suppose that your project, your digital product, actually fills a gap in access.
That's right. So we work with the world's leading authors, academics, clinicians in bringing their expertise onto the platform. And because the platform is digital, it's eminently scalable and therefore affordable for organizations to provide that level of quality and care to all of their people, irrespective of their financial position.
Final observations, call to action for employers on thinking about employee mental health, coming off of COVID-19 and looking ahead in the future. Just any final words?
I think it's incredibly important to keep the focus on this topic. We're just getting started. And there is an incredible opportunity for us as a generation in the workplace to have a meaningful change so that stigma is never again a part of the conversation around mental health. Let's really push this forwards to normalize it. Let's focus on prevention, and let's be bold in our ambitions.